Hey there. One of the most challenging yet essential topics we as therapists need to navigate with clients is sexuality. Today, I want to give you a framework for how to help your clients explore sexuality in a healthy, empowering way without shame, discomfort, or avoidance. We're going to cover 7 ways that you can work with your clients to increase sexual health and awareness. I'm Dr. Stacy Reuille-Dupont, a psychologist specializing in the connection between mind and body. And whether it's overcoming sexual dysfunction, healing from sexual trauma, reframing limiting beliefs around pleasure and power, or addressing sex addiction, we psychologists have a role to play to help our clients embrace their sexuality, heal from sexual trauma, and build healthy relationships connected to this biological drive. Step 1, normalize the conversation. For many clients, talking about sex is uncomfortable, even in therapy. The first step is normalizing the discussion. So simple statements like, a lot of people struggle with this, and it's totally normal to talk about it here, can make a huge difference in helping clients open up. I also ask a lot of open-ended questions, things like, what messages did you grow up hearing about sex? And what does intimacy mean to you? These types of questions help clients explore their own experiences without judgment. Step 2, address underlying beliefs and trauma. Many clients carry deep levels of shame or limiting beliefs around sex, whether from culture, religion, trauma, or past experiences. Some believe pleasure is selfish, or I'm broken because I don't enjoy sex. Our job is to help them unpack these narratives and introduce new perspectives. I often encourage self-compassion work, reminding clients that pleasure is a birthright, not something to feel guilty about. For those with sexual trauma, body-based techniques, things like somatic experiencing or sensory motor psychotherapy, can help rebuild safety in the body and reduce dissociation. Step 3, addressing sex addiction. Sex addiction is often misunderstood. Many clients feel deep shame and secrecy around the compulsive sexual behaviors, and therapy should be a judgment-free space for them to explore those concerns. I often help clients differentiate between healthy sexual desire and compulsive patterns. We look at things like, is sex being used as an escape from emotional pain? Is there a cycle of intense craving, brief relief followed by shame and distress? Is it interfering with relationships, work, or daily life? And treatment often involves regulating the nervous system, since compulsive sexual behavior is often tied to dysregulation. Cognitive work to help identify triggers and patterns, as well as building healthier coping strategies. So sex is not a compulsion. Sex addiction isn't about too much sex. It's about using sex to cope in a way that feels out of control. Our role as therapists is to help clients rebuild a healthier relationship with their sexuality and their intimacy. Step number 4, healing sexual trauma and reconnecting them with the body. For clients who have experienced sexual trauma, intimacy can be terrifying. Even if they desire connection, their body may react with shame, fear, numbness, or anger. So in therapy, I help clients rebuild their sense of safety by addressing body shame. Sometimes through mirror work or mindfulness, guided touch exercises can reconnect the client with their body with kindness and neutrality rather than judgment. We have to work on sensation tolerance, helping clients become aware of subtle body sensations without dissociating. Even feeling warmth in their hands or the pressure of their feet on the floor is a start. We have to deal with anger and fear. Validating their emotions rather than suppressing them is important. Experiencing anger at past harm in a safe, controlled way can help clients reclaim their own power over their body. I want to give you a tool that could be helpful here. Sometimes I get a little overwhelmed trying to figure out the best exercise for the client in the moment, yet I know they need a movement or they need some sort of somatic break from cognitive process to really deepen their healing. If you're looking to help your clients or yourself build a deeper connection to your body, release some tension, and improve intimacy, I highly recommend using these somatic exercise cards. This deck has 42 exercises that you can draw, you can do with your clients to help reconnect them to their somatic experience. Just draw one, put a bunch together. It can help your clients engage in movement and bring some awareness as part of their healing journey. You can find the link to these cards in the description below. Tools like this can be a game changer for increasing body awareness, reducing discomfort, and supporting overall sexual health without the judgment. So check them out, see how they can enhance your journey as a therapist towards helping clients heal and increase their own ability to feel pleasure. So step number 5, navigating intimacy with a supportive partner. For clients and relationships, a supportive partner can be an essential part of the healing process, but only at the client's pace. I help clients and their partners develop step-by-step re-engagement plans, starting with things like non-sexual touch, things like hugs, hand-holding, massages without expectation. This rebuilds that trust and physical connection. There also needs to be some sensory exercises, encouraging the client to focus on what feels good rather than pressuring themselves to perform. We also need really clear communication, so teaching clients to say things like, I'm okay with this, but not that. Or I need a moment, I need to pause, I need to take a break. Things like, let's slow this down. For partners, I emphasize the importance of patience, reassurance, and checking in often. Healing sexual trauma takes time, but intimacy and pleasure are still possible with the right support. Step number 6, help clients express their needs and their boundaries. So similar to the last step, but a little bit different, because many clients just struggle to communicate their desires or set boundaries in relationships. I just use a simple yes, no, or maybe framework. What do they want more of? What are they curious about? Maybe they want a little more discussion around. And then what are their firm no boundaries? Practicing these conversations in therapy can help clients feel more confident in their relationships. Step number 7, highlight the psychological and physiological benefits of healthy sexuality. Finally, we can help clients understand that fulfilling sexual connection, whether solo or with a partner, has real mental and physical benefits. It lowers stress and anxiety, it boosts self-esteem, it helps deepen connection in relationships, it improves sleep and mood. Sexuality isn't just about pleasure, it's about health, self-worth, and emotional connection. If you're a therapist working with clients on sexual issues, start by making these conversations safe and shame-free. And if you want more tools for integrating psychology and body-based healing, check out stacyRD.com for more resources. Let's keep the conversation going. What are your biggest challenges when discussing sexuality with your clients? Drop your thoughts in the comments below. That will help us all become better therapists. Visit stacyRD.com or subscribe for more insights. If you're a therapist looking to deepen your skills, integrate movement and nutrition into behavioral health, and navigate the complexities of delivering exceptional treatment, you're in the right place. Subscribe to my newsletter for expert insights, practical strategies, and innovative approaches to mind-body psychology. Drop a comment below so that I can know what kind of thoughts or questions you might have. I'd love to hear how you're applying these concepts in your own practice. And don't forget to subscribe to the YouTube channel. Follow me on social media and explore more resources on our blog at stacyRD.com.